I'm Julia Steinberger from the University of Minnesota, and I am glad to be here in Portland at the AHA Lifestyle Meeting to learn and discuss with everybody the state of heart health of our children. I will be spending some time this afternoon discussing this topic and basically the important points of this conversation as far as summarizing the heart health of our children are the fact that unfortunately less than 1% of our children are heart healthy, and the main reason for the loss of this heart health has to do with unhealthy dietary and physical activity behaviors. The message I would like to send out to our colleagues in all areas, adult and pediatric areas, is that I strongly believe that we have to be proactive about maintaining the ideal heart health that most of our children are born with, and continue helping the population along those lines of heart health, as well as, unfortunately, the need to improve the heart health of many of our children from the poor health to attain those levels of intermediate or even ideal health.
Thank you. I'm Elaine Urbina, Director of Preventive Cardiology at Cincinnati Children's Hospital. So before we can even improve the heart health of our kids, we have to know how to measure it. So I'll be discussing the metrics to measuring ideal cardiovascular health. And it's a bit more challenging in youth than it is in adults. We can't use a single cut point for level of adiposity, for example, because children are growing over time. There are also changes in blood pressure and in lipids across adolescence, and so it is quite a challenging thing that we must do. However, it's necessary. There's good data out there, at least in middle age and onward, that if we can maintain ideal cardiovascular health, we can prevent future heart attack and stroke. So as Julia says, we have to start now because our youth are our future.
I'm Sarah Ferranti, Director of Preventive Cardiology at Boston Children's Hospital, and I wanted to share a few points about strategies to improve cardiovascular health in our youth. One of the key factors is really identifying deficits in cardiovascular health and strengths in the individual and in the population. And to identify these things, we need to be screening our youth. And screening might be as straightforward as asking detailed questions about physical activity or diet or measuring BMI, or it might be a blood test or a blood pressure. But if we don't take a look, we're not going to know what we need to address with our individual patients. We do have some effective tools to modify and improve cardiovascular health, lifestyle, and in rare occasions, medications. And we have some information about their efficacy in kids, but we need to gain more information about the best strategies to approach improving overall cardiovascular health.
And I'm Justin Zachariah from Texas Children's Hospital in Houston. And I have to congratulate the American Heart Association for making that shift from focusing on individual risk factors to trying to improve the cardiovascular health of America by keeping cardiovascular health in children. And this requires two foci. One, focusing on risk factors in children themselves and reversing the ones who have already become abnormal. But then there's another aspect, which is childhood is fundamentally a healthy period. How can you maintain that healthiness throughout the life course? And that's really the topic that we were invited here to speak about during AHA 2017. We will review, and I did review, certain aspects of that intervention, looking at how to maintain a broad-based approach to maintaining cardiovascular health, especially on a public policy perspective. And there are definitely ways in which agenda setters in the community, within healthcare delivery systems, and across governmental agencies can help maintain and improve the cardiovascular health of children in America, and thereby improve America's heart health in the future.